In the world of breast cancer, two essential tools come into play: the diagnostic mammogram and screening mammogram. The purpose of today's video is to help you understand the different purposes, different timing, and the different utilities for these two mammograms. The purpose of a screening mammogram is to detect breast cancer early, before any signs or symptoms of breast cancer may appear. The purpose of a diagnostic mammogram is when there's a specific sign that appears that may make you suspicious for breast cancer. A diagnostic mammogram is very helpful in evaluating to see what may have caused this particular concern. A screening mammogram is usually recommended on a regular interval. This can be every year or every 2 years. And this depends a lot on your own personal risk factor, like family history, whether or not you carry a gene that may predispose you to breast cancer. And depending on your own risk profile, the screening may start at different ages. A diagnostic mammogram is performed as needed, as soon as you express your particular concern, to evaluate if there's anything that may be suspicious. And this is regardless of your age. A screening mammogram involves taking standardized multiple image of both breasts. And again, this is regardless of if you have symptoms or not. A diagnostic mammogram involves taking additional views of both breasts, and this could include using certain techniques known as spot compression or magnification to further evaluate the area of concern. Compression is sometimes needed to spread the breast tissue to get a better image, especially if a patient has implants. But generally speaking, compression is less intense in a screening mammogram. During a diagnostic mammogram, compression may be more intense because the radiologist needs to get a very specific view of the certain area of concern. The results of a screening mammogram are usually reported as normal or abnormal. If the results come back as abnormal, there's usually a recommendation from the radiologist what other workup may be necessary, maybe an ultrasound or an MRI, or sometimes even a biopsy is necessary. The diagnostic mammogram will either report a specific diagnosis if that is definitive. If there's no definitive diagnosis, then the radiologist will recommend further evaluation to help you reach that diagnosis.